I'm Dr. Stefan Lo. I'll be talking to you today about some of the most common questions we get asked about anti-wrinkle injections. Anti-wrinkle injections, or muscle relaxants, work by relaxing the muscles that causes wrinkles. A lot of the wrinkles in our upper face, like the frown lines here, the crow's feet around our eyes, or the forehead lines, are caused by repetitive folding of the skin when we do certain facial expressions. By relaxing these muscles, we stop the ongoing stress on the skin so that our lines don't get any worse. Furthermore, because our skin has a natural ability to regenerate, when we stop the constant folding, this gives the skin a chance to push those wrinkles back out. So the muscle relaxants work both as a prevention and as a cure. Muscle relaxants are prescription-only medicines, and like with any other medicine, incorrect use can be harmful. Similarly, even too much Panadol can be bad for your health. However, if used correctly, it is a very safe and useful medicine. Unfortunately, our industry at the moment is still quite unregulated, and that's the reason why you see these news stories about people running into problem with so-called backyard treatments. If you do to proceed with anti-wrinkle injections, it is best to go to a reputable clinic, because if you don't, you may run the risk of receiving an unlicensed product that has not been approved for use in Australia. The most common side effect is bruising from the injections themselves, but because the injections work on muscles, sometimes the wrong muscle can be relaxed. This is quite rare, less than 1% of cases actually, studies have shown, but there are definitely techniques to minimize this. So if you do receive the injections, please go to an experienced person administering it. That way the chance of side effects is less, but also you can feel safe in the knowledge that if in the rare case that something does go wrong, you're in the safe hands of someone that can manage it. I personally like all my treatments to look nice and natural, and this is achieved with experience and knowing precisely where and how much to give. There's also an element of artistry in this industry. I mean, it's like I can use the same paints as Michelangelo, but unfortunately I'm not going to be able to paint the Sistine Chapel. I'm a medical doctor, and all the practitioners at Concept Cosmetic Medicine have done extensive training specifically in cosmetic medicine. This is to ensure that your treatment can be the best possible so that you look fresh and rested, not done or plastic. After all, what we want your friends and family to say is how well you look, not what the beat have you done. Unfortunately, the treatments don't last forever. And if you do like the result, you do have to repeat it over time to maintain it, so that we can keep those wrinkles in a time capsule for you. Now, at any time you can stop. And if you stop, nothing bad would happen. Your wrinkles don't go any worse. They simply go back to what they were before you started treatment. The injections are a little bit uncomfortable, but at CCM we offer gas to make it as comfortable for you as it can be. The treatment is actually surprisingly quick to perform. A lot of people rush in to see me and squeeze me in their lunch break. Why don't I show you now? So here we have Belinda, who's been kind enough to volunteer as our model for our live injecting session today. Now, Belinda has some lines that she would like to be softened, so we're going to help her with that today. I'll just ask you to raise up your eyebrows for me, Belinda. As you can see, she's just starting to get some forehead lines there, so we're going to soften them a little bit for her. And give me a big cheesy grin, Belinda. And these are Belinda's bugbears. She's just getting some of these so-called crow's feet over the side of her eyes, which we're just going to make a little bit better for her. Now, this is all in the premise that what we want to do is make her still look fresh, but most importantly, natural. Just give that area a bit of a wipe, just to disinfect the area. So Belinda, I'm just going to get you to raise up those eyebrows as high as you can go. Perfect. Now, close your eyes there. You'll feel the tiniest little scratch. There we go. Little sting. Well done. And raise up those eyebrows again. And relax there. Same thing. Little scratch. Little sting. Raise up again, please. And relax there. So that's Belinda's forehead all finished. And we're just going to go for around her eyes there. we're all done. How was that, Belinda?
It was not even a little bit sore.
So we've got Belinda here who's come back for her 2 weekly checkup. So let's have a look to see how we went. So now we treated Belinda last time for her forehead. So I'll just ask you to raise up your eyebrows as high as you can go. That's great, because what we can see there is that Belinda now, when she raises up her eyebrows, she's still got nice movement, so it looks nice and natural, but those lines are a lot softer. There's still just a tiny little bit there on raising, but that's in keeping with that natural look that we wanted to achieve. Now let's have a look around her eyes. Just get you to give me a nice big smile then. That's beautiful. So whereas the lines before were a little bit deeper, they're certainly softened up a little bit, but again, she's still smiling normally, so it's just softened everything for her without it looking done or plastic, which is exactly what we want.